Yeah.
And from Dr. Dixon's note, he said you were firing your neurologist.
Mm-hmm. Okay.
And in Dr. Dixon's note, he said that you had not only some underlying lung disease, but also some neuromuscular lung disease,
Mm-hmm.
cutting down how well you're able to get air in and out.
Yeah.
And that they hadn't been able to figure out what was the cause of the neuromuscular disease.
Yeah.
Now, who were you seeing for a neurologist?
Brain doctor?
Yeah,
Waterville.
in Waterville.
Yeah.
Do you remember his name?
No. Too many doctors with temporary doctors. Yeah, I think it's Kinney Back Road or something like that.
When was the last time you saw him?
4 or 5 months. How you been?
Fighting a cold for a while.
Yeah.
What sort of tests did they do to try to find out what kind of a problem this was?
The leaving that tube.
Okay. That would have been Dr. Dixon, right?
Yeah.
How about though the neurologist? Had he done anything to try to find
No.
out what this neuromuscular problem was?
All they do, give me pills from my head. They do no testing.
They didn't do any testing then?
No.
Okay. The neurologist that you were seeing, was it a neurologist or a psychiatrist?
Brain doctor.
Okay, now, did PCHC send you down there?
No. Jake Joseph's 900 block did.
Who did?
Part of Jake Joseph's hospital.
Okay.
It's 900 block on Broadway.
And you had your sleep study.
Yeah.
And we have 2 reports. Would you like a copy of your report?
I brought the copy in.
Oh, you brought the copy in?
Yeah.
All right. I have got 2 copies here, so works out good.
Yeah. controlling pressure from pressure 8 went up to 10.
Okay. Yep, you're right. They started you on 8 and you went up to 10, and that seemed to work. You're not driving anyway, are you?
Got no car.
I was going to say, I've got Dr. Dixon's note here who read your sleep study and said he would encourage weight loss as well as avoidance of sedating medications and beverages when feasible, and would caution the patient regarding driving safety until symptomatology is fully controlled. I didn't think you were out there driving around since you've been on the bus. I think we've done a serum ferritin on you.
I think I need an MRI of my elbow here.
Tell me about it.
Painful. Feel like it's broken.
Did you hurt it?
When all that pulling on that seat and that power chair back and forth. Probably did something to it.
We did do a serum ferritin. I'll have to send it over to get Dr. Dixon. Yeah, your serum ferritin was fine. It was 238. I thought we had. Now, one of the things that Dr. Dixon noted on your sleep study was that you had a lot of arousal, even though they were able to control your breathing episodes by using the CPAP.
Yeah.
You were still waking up a lot.
Yeah.
And in fact, during your time in bed, your sleep efficiency, time in bed versus sleep time,
Yeah.
was only like 70%.
Yeah.
And that was considered moderately severe.
Mm-hmm.
And one of the reasons that was occurring, they thought, was because of the limb movements, periodic limb movements of sleep.
Mm-hmm.
Some of the things that can cause that include iron deficiency and things like that.
Yeah.
Well, I had looked at that back in November to see how our iron studies were, and we did a serum ferritin on it.
Yeah.
Dr. Dixon was suggesting treating if it was less than 50. Your
Yeah.
numbers were 227.
Yeah.
So, as far as your total body iron stores and that causing your being low and causing your restless leg, periodic limb movement, that's not the case. So I'll make sure that he gets a copy of that.
Yeah.
There are medications that can be used to treat restless legs.
Yeah.
But the other thing he thought is that as long as we don't have an iron deficiency, getting you on a correct CPAP, making sure you've got enough oxygen in the blood, that might make a big difference overall. And I think that's reasonable.
Yeah.
Now, does he have you scheduled to have one of those little cards dropped off to see how things are going?
Yeah.
Okay. I'll talk with him and see about...
I was so maybe in March.
Okay. Is Sleepwell monitoring you with a little card that they're going to...
Well, I told that doctor I need a new machine.
Okay. Yeah, what they can do is they can put a little card in the machine,
Yeah.
tells us how well it's working for you, how much of the time you're in various stages of sleep and everything
Yeah.
else. So I'll see if Sleepwell's going to do that, or if Dixon has to order it, or whatever.
Yeah.
Because that'll let us know if the CPAP is working. And if the CPAP is working, but you're still feeling tired,
Yeah.
then what we would do is we would look about trying to get you on something for the periodic movements.
Yeah.
How's the diabetes doing?
Okay. The machine seemed like they had breathe harder than that sleep study. Sleep study is much better, a lot more easier to breathe.
Okay, good. Who do you want to see for a neurologist?
Okay.
Have you seen any of the crew up around Bangor?
No.
Okay, we'll get you set up.
Let's see, where is that? Is it on the nerve test?
Yep.
Is there any more treatment to do?
Now, do you mean on the back?
Hmm?
Which nerve test do you mean? Looks like it's going to be part of this one. 3, 3, 3, 3. Looks like it's going to be these two, and then it's first one. Okay. Yes, there is. This would be a second reason. Actually, you got this before I did.
Yeah.
This would be a second reason, and I'm going to make a quick copy of this. This would be a second reason to have to see the neurologist.
It's gonna be real serious.
Yep. This would be a second reason to have to see the neurologist,
Yeah.
because with your peripheral neuropathy
Yeah.
and the neuromuscular disorder that they're talking about, this could very well be in part related to that.
Mm-hmm.
Some of it is, some of it isn't.
Mm-hmm.
Because when you look at the results of this report,
Yeah.
it says, okay, there's pressure on the nerves here,
Yeah.
there's pressure on the nerves at the elbow.
Yeah.
Those can usually be taken care of surgically.
Yeah.
And then it also looks like there's still pressure on the nerves from up in the neck.
Yeah.
So looking at all of those things, I would say, number one, because we know there's a problem involving the lungs,
Mm-hmm.
it may in part be due to some of the arthritis in that in your neck. It may in part be due to an underlying muscular disorder along with nerve disorder. And that's where we would put you in the hands of a good neurologist.
Yeah.
So I think with Dixon's letter showing that your pulmonary function studies show that you're unable to exhale well enough, and you're unable to suck air in well enough. And the abnormalities that we find showing this diffuse peripheral neuropathy, plus the work that we've done checking B12 levels, folic acid, everything else, yes, I think the thing to do is get you to the neurologist and say, what else can we do to treat this problem?
Yeah.
Some of it may be surgical. The surgical part may be related to carpal tunnel, ulnar tunnel, things like that.
Yeah.
But there is something we can clearly do on the arm. But the rest of it, I would put in the hands of the neurologist and say, what's the best way to go after it?
Yeah.
Because I'm not willing to say this is all secondary to just diabetes, or it's all just secondary to arthritis in the back, neck, whatever.
Yeah.
I think there's more to it.
Yeah.
I have a hard time finding where the diaphragm, which helps as far as you getting air in and out of your lungs, is also affected by looking at your breathing studies.
Yeah.
So it's a matter of getting the right people in spot to say, okay, here's what we've identified. This isn't something you're making up. We've got hard, fast proof it's here.
Yeah.
What can we do to get it better?
Mm-hmm.
Now, from a diabetes point of view, how are your sugars running?
Well, I need to stir some for a new mom there.
We can do that. I don't have any problem with that. Yep, I'll be happy to do that.
That's my message I got back from their insurance company, City of BANGOR.
They've got advertising from Home Depot. Okay. Let me make a quick copy of both of these.
Yeah. Working hard?
Oh yeah.
Having fun?
Oh yeah.
Well, when spring gets here.
Sick of the snow.
Yeah.
You're welcome.
Nice sink. I like the river sink. Where I live at, got the real old kitchen sink. I don't like it. I like a regular sink
Yeah.
instead of too hard to wash dishes.
There you go. Alright, so I'll look into both of those. And we'll get you set up with a neurologist. How long's your meter been broke?
How you can tell that the nerve here or something come loose or our bone broke? That hurt when you move the arm like this. Hurts.
When did you hurt that?
Probably came from that injury on that city bus.
Okay.
And then the MRI shows something there broken.
Well, we know that there's damage there on that nerve.
Yeah.
Have you had the MRI on that elbow yet?
No. But I mean, you need to order one, probably.
Okay. Did they do plain x-rays?
I don't think the brain X-rays show up or anything. I think the doctor that
No, usually plain x-rays won't, but
I
In
think
order for the insurance companies, everybody to be happy, you have to do plain x-rays,
yeah.
see if there's anything grossly there,
I
and then
think-
after the plain x-rays don't show anything.
I think Jake Joseph's hospital took x-rays of everything there, and it
Okay.
showed up and broke it. Yeah. That doctor did that EMG, no, it took my hand, tried to put that on the table. Oh, it's painful. I jumped. I put it on the table, I stood against the wall, and put it down myself. That's how painful it was. And I feel in both fingers, feel like something like needles stabbing your fingers.
Now, when you fell on the bus, did you hit your right elbow or your left?
What happened on the bus driver tied down the right side. I told him he wouldn't tie down the left side down to the bus. I told him to tie it down, he refused to do it. How about you making a turn and I tip over? He said, grab a hold of the bus seat. I grabbed hold of the bus seat without tipping over and going back and forwards. Like on a white,
Okay.
like you're on a walker, you know, white chair like a walker walking back and forth. All that pressure pulling on that elbow. And on this, in the right hand, I hold on that arm, the arch, and keep it up. And the bus didn't even stop. It made a full turn and got off the Ledbetters. And two women on the bus hollered out to the bus driver I was tipping over. He still didn't stop the bus. In my sleep today, I got up a lot to use the bathroom.
What's that?
In my sleep study, I got up a lot to go bathroom with a lot of water out. Seemed like it take a long time to fall asleep.
It did. Took you like 23 minutes to fall asleep from your sleep study.
Yeah.